Hi everyone, and welcome to today's webinar on the enhancements to NZePS in Medtech evolution. This webinar is going to cover the same content from our last NZePS webinar, as well as the new enhancements that have just been made available. We appreciate how busy everything is at the moment, so thank you very much for joining. If you can't attend the entire session today, a recorded copy of today's webinar will be made available by middle of next week probably. So we will get started on the agenda. So we'll start with a few pointers on how to use GoToWebinar, and then I'll begin the presentation. We'll have time for questions at the end of the presentation, but if you have any questions about the audio or visual connection to GoToWebinar, we'll try and answer those immediately. You should be able to see the control panel on the right-hand side of your screen. Click the orange arrow to collapse the control panel. The orange microphone tells you that you're muted. All audience members will be muted for this session. Next icon will either maximize or minimize the screen that you're viewing the webinar in. We recommend keeping it maximized. And if you have a question, please type it in the box where it says enter a question for staff, and we'll answer it at the end of the session. If your question isn't answered directly, someone will be in touch in the next couple of days to assist. So it's time to get things started. My name's Holly. I'm the Clinical Product Specialist here at Medtech. I'll lead the presentation today, and at the end of the presentation, Romit Walters, our Product Specialist, and Chrissy Patterson, our Product Manager, will commence the Q&A session. Before I start the demo, I just want to point out that the webinar today is designed to be based around the workflow of NZePS in evolution. So I won't be demonstrating every single message or status of prescriptions and other functions. That's all explained clearly with screenshots and instructions from the documents in our Insight customer portal. I'll list those resources at the end of the presentation. And just to reiterate, I'll repeat the content that was demonstrated in our last webinar, as well as the new enhancements that are included in the 2.0.0.71 release. Okie doke, so we'll get started. I'll just open up Evolution. Okay, so the overarching structure of NZePS is that when you prescribe, sorry, we're just having a few audio issues. Hopefully that's better. So the pharmacist receives a physical prescription and matches it by the barcode to the script that's been uploaded into the broker. I'll talk about signature exempt prescribing a little bit later in the presentation. So previously we've communicated that prior to activating NZePS for evolution, you need to contact the Ministry of Health to get your credentials. However, in response to the pandemic of COVID-19, and in order to encourage practices to utilise the NZePS functionality, all practices have had their credentials generated by the Ministry of Health, so you can bypass that step now. You need to be on a minimum version of Evolution 2.0.0.57 to use this. If you encounter any errors when activating NZePS, you need to contact the Ministry of Health in the first instance, just to check that those credentials are correct for you. So in the PMS, the first step is to check that the HPI facility number is set up in your location. So we'll go into our location settings, and that's found under the Codes and Defaults tab, and the HPI facility number there. So all practices should have that. Next, you need to identify all green scripts, which are drugs that aren't dispensed by a pharmacist for your practice. The reason you need to do that is to make them identifiable in the PMS, so they're not included in the electronic prescription messages. If your practice doesn't use green prescriptions, you can skip this, but to run that, it's found under the Utilities ribbon menu and green script update there. Finally, we need to activate for ePrescribing. So we'll go into our Setup menu under Connected Health Information Services and EPS Setup. So here you need to tick the 2 check boxes at the bottom of the screen, and this button here will say activate. If you want more information on any of the disclaimers here, then you can access that through our Insight Customer Portal. So once you've completed those steps, you need to click on the Activate Staff tab here and choose which staff members you're activating to use NZePS. So just reiterating, NZePS is not an all or nothing process in your practice. You can have certain prescribers choosing to use NZePS and certain prescribers that don't want to use it. That's absolutely fine. If you want to activate a staff member though, they need to be set up as a provider and a service provider and have an HPI CPN number and relevant registration number in the provider tab of their staff setup. If you want more information on staff setup, read the full release notes. Okay, so once you've activated your practice, you prescribe medications the exact same way that you normally do. So it's really important to remember that the workflow of prescribing medications hasn't changed at all for your practice. There are a few additional details, but the general workflow is the same. So if we go to a patient, we might be able to just use this one. So in here, if I'm seeing this patient, I might decide that I want to repeat the prescription for them. So I click on my prescription and repeat it. And you can see that medication has appeared in the consultation window here. If I open this medication, you'll see that there's a dispensing tab here. So that's how you know that you've been activated correctly. If we click on that tab, this has important information that you can communicate to the pharmacist if you want to. So you can communicate that you're acknowledging this is an unusual dose or that it's a change in their medication dose using generic names. You can ask the pharmacist to complete an assessment. You can set a reminder to show that if that medication isn't dispensed in however many days. This number here is pulled from the setup. However, you can change it for each individual prescription if you want to. And if you want more information about this section here, click on that little blue question mark, and that gives further information. Okay. So once you've completed your prescription here, highlight that medication at the bottom, and we're going to click the green RX print button. So at this stage, in a clinic, if you're set up to print to a physical printer, that will print the prescription. However, I'm not set up to a physical printer. So we'll just ignore this message and go cancel. And you can see at the bottom, an e-prescription has been generated. So that's how we know that the e-prescription has been sent to the broker. An example of what that would look like is this one here. So it's a barcoded prescription. You can see the barcode on the bottom of the screen. We'll talk more about signature exempt prescribing at the end. So now we'll talk about what to do if you want to amend that prescription. So in this case, let's just say I want to change the dose on that prescription, and I've already sent an e-prescription. What I need to do is click the amend icon, and you'll notice that this icon here is grayed out. And the reason for that is you need to highlight the e-prescription for the amend icon to become live. So you need to amend the e-prescription before you change it. So if I highlight the e-prescription at the bottom and click that amend button, I'll get a warning prompt. So this prompt is telling me that I'm trying to amend that prescription. Click yes. And at that stage, you need to make sure that you have some sort of contingency to remove that physical prescription that you've given to the patient or put out at the front desk to go to the pharmacy, because you don't want that physical prescription to be dispensed. So that's the warning message, is just checking that for you. Once you've pressed that amend button, you'll see that the e-prescription has been crossed out on this consultation window and another prescription has been generated. So you double click on that, and I'm going to change and say that I want to give them much more Panadol. Click OK. And once I've finished that, I press the print button again, and that will generate another e-prescription. So we have had quite a few questions in our previous webinar around amending prescriptions and how to How many times can you amend? What happens to the barcode? Does it change every time you amend a prescription? So the amend functionality in the PMS is kind of like a cancellation functionality. So as soon as you amend a prescription, it's cancelling that barcode. And when you print another prescription and generate another e-prescription, it's going to have a new barcode on it. That's why we say you need to remove that first physically printed prescription, because it will have a different barcode on it from the one that you're going to then send to the pharmacy, and a different dose. Okay, and remember, if that amend icon is grayed out and you can't figure out why, it will be because you're not highlighted on the e-prescription. So you'll see here I've highlighted the prescription itself, not the e-prescription. The amend icon is grayed out. But if I highlight the e-prescription, the amend icon is blue there. All right. So now we will talk about the print and pack functionality. So this function is mainly for when you are generating a prescription on behalf of someone else. So if I bring up a different patient, and let's just say I'm generating a prescription for this patient on behalf of the doctor still needs to check this prescription, so I don't want it to be uploaded straight away. I'll repeat that prescription there. From this screen, instead of printing the green print button, I'm going to print the orange one. And this is a print and pack. So when I click that here, again, that will print to your physical printer if you want to. And you'll see at the bottom, it says packed e-prescription. What that looks like is this one here. So it says draft only for review, invalid, as a banner over the top, and it doesn't have a barcode on it. So once I have generated this, a task will automatically be created for me to say that there's an e-prescription that has been generated and packed for this patient. So every practice has a different workflow on how they notify the prescriber that there's an e-prescription waiting to be verified. So some examples for practices is that at this stage, I would reset that task to the doctor. Some practices have an appointment book just for prescriptions that they would then drop that patient's name onto. Some practices would drop the patient onto that provider's appointment book and annotate in the notes screen that there's a prescription to sign off. So there's a lot of different ways you can do it. Some practices still like to print that draft and have that in the doctor's file or slide it under their door. It's completely up to the practice how they do it. We would recommend that you just follow your normal workflow and absorb that when you start using the print and pack function, or choose not to print that piece of paper in the first place. So now I will be the doctor and I'm going to verify this prescription. So I'm happy with it, happy to prescribe. So I highlight the e-prescription here and I press the print button. So what that's going to do is change that packed prescription into an e-prescription, which then goes off to the broker with a barcode on it and no draft banner at the top. All right. We will definitely answer any questions around that at the end of the presentation. Once you've printed that prescription, you give the physical prescription to the patient if they're in front of you, or if it's a repeat prescription, do whatever you normally do if it's going out to the pharmacy to be faxed or posted to the pharmacy as per your normal process. So now we'll talk a little bit about paperless prescribing. So this is also called signature exempt prescribing. This is the process of emailing or e-faxing a PDF copy of the prescription to the patient or the pharmacy, which is then matched to the electronic prescription stored in the broker. E-faxing is one of the enhancements that's been made available in our latest release. So there's a current Director General of Health waiver that permits signature exempt prescribing during the COVID-19 lockdown period. So the Ministry of Health have indicated that this will expire when that notice is revoked or expires, and they haven't advised any further on that, so it's still in place at the moment. Signature exempt prescribing is not authorised for controlled drugs, and I'll talk specifically about controlled drugs towards the end of the presentation. Before I cover the workflow, I'll just quickly go over the setup that's required for either e-faxing or emailing prescriptions. So e-faxing doesn't require a physical fax machine or a hardwired phone line because the fax is sent out over the internet. So if you're wanting to use the eFax functionality, you first need to sign up by contacting your account manager or emailing us at sales@medtechglobal.com. Once you've completed that, we then provide you with credentials which you need to enter in your location settings. So you'll get the credentials from us, and then if you go into your location and under the Web Forms tab, you'll see at the bottom the electronic fax details here. Okay. Depending on how once you do that, you must remember that you have to log out and back in, and then make sure that you restart your Medtech services on the practice server as well. So with your email, depending on how your email is configured, you may or may not see the email that's being sent. In order to do signature exempt prescribing, there are a couple of things you need to do with your print settings. So firstly, to make it signature exempt, we don't need to physically print the prescription. So in your print setup, we want to print our prescriptions to a PDF, like here. The pharmacy option at the bottom should be left blank unless you have a pharmacy on site that you print directly to. So don't change that one there unless it's already there. In order to be able to email prescriptions to a pharmacy, an email client or SMTP needs to be configured on each workstation. So if you're working from home and remoting into a server, you need to ensure that there's an email client installed on that server. And we recommend that you use a generic email account on the machine, so that same account can be used by all providers that are connecting, and it doesn't need to be reconfigured. If the recipient for the email should be stored in your address book. So I'll just go over that here. So in your address book, my pharmacy is called Happy Pharmacy. So here we've got the email address, email details in there, and also the fax details if that's what you're going to be doing, faxing. So to begin, you prescribe your medications as you have done. You would print, like I do, have it set to a PDF, print it and cancel when you get the PDF save message, because you don't need to save that PDF. E-prescription's been generated, so we know it's a barcoded prescription. And then you're going to select the send to fax or email prescribed medications that are in bold icon. So that brings up this window here, and this ellipsis connects through to your address book. So you just find your address, your pharmacy for there, and you either click email or click fax, depending on what you're trying to do. So for the purpose of a live webinar, I have not enabled my Outlook, otherwise I get emails the whole time I'm presenting. But when you get an email, or when you send an email out, you get this message here. So you can see in the subject line, it will say the prescription from what your location is for the patient's name there, and you'll see the prescription's got a barcode on it, and that's sent as a PDF to the pharmacy. Also at this stage, you can enter the patient's email address in here if you want to as well. So you can email that prescription to the patient and the pharmacy, or just the patient, or just the pharmacy. Just go back to Evolution. Okay, so when you email or fax that prescription, a new patient contact entry will be added into the daily record. So this is one of the enhancements from the latest release that we have. So if I look at this patient here and open their daily record, which patient might bring up Colin? So for Colin, you can see here, a patient contact is written back into the daily record telling us that this prescription has been emailed to the pharmacy, and it captures the time and the person that's done it, or it would say faxed, like this one here if I had faxed it. Once you've faxed a prescription, you can check the status of the fax under Tools, Messages Lodged, and if you click on the fax there, that will list all the faxes. It'll tell you the status and any explanation of failure if for some reason that fax hasn't been sent. So patient contact will automatically write into the daily record, so you don't need to write that in your consultation notes. That's already captured. This information is also captured in the View Medication screen. So if I open that medication and click on the Audit tab, it will also capture details of, sorry, that's not the one that I had emailed. Which one? Here we are. It will capture the details of when it was emailed, which pharmacy it was emailed to, and the SKID of that prescription. So we will now talk a little bit about controlled drug scripts. So NZePS controlled drug scripts must still meet the current regulations, which is that they require a physically signed prescription to be sent to the pharmacy within 2 days of that prescription date. Non-NZePS controlled drugs require that triplicate form to be completed and sent to the pharmacy. So what that means is you can't use signature exempt prescribing for controlled drugs. We had quite a few questions at our previous webinar, which were about if you're prescribing controlled drugs, if you're doing signature exempt prescribing and then you need to prescribe a controlled drug, do you have to change your print settings to print that prescription out and then change them back again to go to signature exempt prescribing? The answer is no, you don't have to do that. So if you are wanting to do a prescription for a patient, if I go back to a different patient, and let's just say this prescription here is a controlled drug, what you can do is if you're set to print to a PDF, just give this drug some directions. So if we print it and it prints to a PDF, you can choose to print this PDF and just save it somewhere and print it for the patient and then exit out of that screen, and that still generated the e-prescription. And then you don't have to go into your print setup screen every time you need to prescribe a controlled drug. It's completely up to you how you do it, but some practices didn't want to tutu with their print settings frequently. So I'll just show you now our resources on our Insight Customer Portal. So bear with me for a second. So here you can see on insight.medtechglobal.com under COVID-19 resources, we have an NZePS resources for Medtech evolution screen here. So if you click on that, you'll then get a list of all the available resources. That's user guides, setup guides, also webinars. The webinars are nice and short and to the different workflows, how to prescribe, how to amend, and that sort of thing. So it's a really good place to send your staff if they're a little bit unsure of how to use it and you want them to just read the functionality that's specific to their role. So that concludes my demo part of the presentation. What I will do is hand back over to Chrissy and Romit, and they will kick off the Q&A session.
Thanks, Holly. If you just want to bring Evolution back up onto the screen, and I'll get you to just demonstrate one of those activities that you just had up before. One of the questions that we have is around if you could please just re-show the step for doing an amend on the prescription and just go over that again.
Yep, absolutely. So if you need to amend the prescription, what you need to do is highlight the e-prescription line here and click the blue amend icon, and that will give you this warning message. So you're going to chuck away the hard copy that you might have just printed, and that will cancel that e-prescription off the screen and reproduce the exact same prescription for you to then open. You're going to change your prescription, whatever you need to change, and then you click back on that and print it again to generate another e-prescription. So while we call it amend, it's kind of like a cancel and regenerate function.
Well, thank you very much, Holly. The next question here is how many pharmacies are on the system? So I'm assuming that you're referring to how many pharmacies can actually utilize the barcode scanning on the NZePS scripts and can receive the e-prescriptions. Every pharmacy in New Zealand has the capability to receive e-prescriptions via the NZePS service. Some pharmacies will have the capability to scan the barcode on the script and pull the medications for that patient directly into their dispensing system, and some pharmacies that don't have the capability to scan those barcodes can actually enter the numeric digits of that barcode directly into their dispensing system, and it will automatically pull them down as well from the broker. So there are the two variations that occur at pharmacies, but every pharmacy across the country has the capability to do so. If you were referring to, just on the opposite side of that, if you were referring to how many pharmacies are available in the address book in your PMS system, that depends on how many that you have added in there yourself. We do have the capability for you to load them into the system via our Insight customer portal on the downloads page, also on the COVID-19 resources page, which can give you a bit quicker access. There's also a pharmacy address book load utility. There's over 1,000 pharmacies available via that address book load, and when you run that, you can choose the region or regions that are closest to you to load into the system automatically into the application. The other question that we have here is actually not related to NZePS, but I'll get Holly to show it anyway. Under the location settings, so that's file, options, location, and opening up your location settings screen on the clinical tab. Under the under the medication section at the top, there's an option at the bottom there called Enable Notes to record additional information. So this isn't related to NZePS, but someone's asked a question around this. This particular option, if you enable it for your practice, when you do a new prescription, there will be a notes field sitting at the bottom of the new prescription screen where you can add information related to that medication, to that patient and their use of that medication, just for your own internal purposes. It doesn't get printed on the scripts. It's not available anywhere else, but it's just for you to record some information that you may want to specific to that information, to that medication for that patient that you're prescribing on at that particular point. So that's what that particular option is available for. On the cloud, there's a question here from a doctor that's on our Evo cloud around emailing scripts and not showing in the audit or daily record. Is that coming in this weekend's release? Yes, it is. You are being upgraded this weekend to version 2.0.0.71, and that includes the functionality that Holly has covered today around the e-faxing and emailing capability, and have it writing back to the daily record and in the audit tab of the medication screen, that information that was covered. The next one, Romit, is one for you. I can't unpack or get rid of the task.
The unpacking, you have to actually, depending on what's going on there, but you have to actually select the parked e-prescription in order for the green print button to show, which will then allow you to unpack the e-prescription, the parked e-prescription, and that should complete the task. Yeah. And if it's not working, then please contact our support team. They will be able to investigate further and figure out what's going on.
So Holly's just showing that on the screen now so that you can see that.
Yeah. Oh, there is one other thing that could prevent it from being unparked. If you go into, if any of the medications in that parked e-prescription don't have a provider who is activated for e-prescribing, then that will prevent you from generating the e-prescription. So the way you would do that is you'd go into the actual each of the medications, and if you can just do that, and then from the provider field, just ensure that each of those medications has a provider who's been set up for it, has been activated for e-prescription selected, and then go and attempt to then click that green print button when the parked e-prescription has been selected.
Okay, so the next question here is around paperless prescribing and its availability after lockdown has been lifted. So we are taking our guidance from the Ministry of Health on that aspect of this. The capability will always be available in the Evolution software. It's not a function that's being turned on or off. So as long as the Ministry of Health still enables you to do signature exempt prescribing, you will continue to be able to do that in the Evolution application. So just refer to the Ministry of Health guidelines around the availability of it post the lockdown when it's been lifted. The next question here is the pharmacy's address book auto-populated, or do you need to add it manually? If you run that update that's on our Insight customer portal that Holly showed on the screen just a bit earlier, that will auto-populate all of the pharmacies within the regions that you select when running that utility into your practice address book. So they'll all be there. You should just go and double check them just to make sure that their information is correct. The information that we were provided via the Ministry of Health and HealthPoint at the time of running the update or creating the update was correct, but just in case, you just need to go through the process of checking it to make sure. Evolution Cloud, how email setup will work. If you're on our Evolution Cloud, most likely your email setup has been configured using SMTP capability, and that your practice will have an SMTP credentials that have been added into your practice location setup. And if you do want to get that working and you don't think you already are, just contact the cloud support team and they'll help you doing that. Can you please show the icon to activate an ePrescription?
Sure. So I think this person's also asked just to go over that process of prescribing the normal prescription workflow again. So I'll just cover both of those. So if you open up your patient and you're going to either generate a repeat prescription or create a new prescription there. Well, that person's got a nice face. So if I'm prescribing for this person paracetamol, so you do your normal prescription and then go through. Once it's in this view new consultation screen here, if I'm happy with just that prescription, I can highlight and click the green RX button. So printing that prescription, because I'm activated as a staff member and my practice is activated for NZePS, that triggers the ePrescription to be generated and sent to the broker. So that print button does two things. It prints either the PDF, because I have it set to print PDFs, or it prints the hard prescription and it uploads the ePrescription to the broker. So this prescription here is what would have either been printed in physically hard copy or to PDF. So that icon there is the one that starts, the green RX icon is the one that triggers that process.
Well, thank you, Holly. Address book pharmacy, searching for pharmacies in the address book. If you don't know what name it starts with, is there any tips and tricks for that? So you can use wildcards when searching, just like you would do in a patient search. So you could put space, live space Unichem, you could do a star at the front of it to search, all the same sort of search capability you can use in your patient search screen, you can also use in the address book screen as well. We do have an enhancement coming in one of the upcoming releases to allow progressive searching in the address book. That's not available yet, but that will also help you a little bit later on when searching through a lot of entries if there are any in the address book screen. And the next question here, e-prescription activation, is it only for providers submitting the e-prescription, or are the other clinical staff parking the e-prescription counted in the number of users?
So I'll answer that. So the number of users, I think, would be just the ones that have been activated from. Oh, so they're probably talking about how many people would they get charged for, is it?
Mm-hmm.
Yeah. Okay.
I imagine so, yeah. So does a person that's doing a print and park need to be catered for as the number of users? Do they need to be activated to do a print and park process?
No, they do not. So print and park can be done by anyone as long as the provider from the medication is anybody can do a print and park, but when you're doing the generation of an actual e-prescription, you need to ensure that the provider from the medication is a provider who's been activated for e-prescribing.
Cool, that's great. And the next question here is there a way to see all e-prescriptions generated in a day to use for billing?
Yes, that would be the, so if we go to, I have to just figure out where it is now. I think it's under patient. And there's an e-prescribing.
Holly, drop down the medications option, the little black arrow, yep.
Yeah, that's it, patient e-prescriptions. So this can be filtered to see how many you got. Can you just open the filter, Holly? Yeah. This
Yeah,
can
so
be
if you take the
filtered for
patient off.
dates and you can see every single.
Yep. So there you go, so that's under patient, medications, and patient e-prescriptions. You can put it on the quick access toolbar there, as Holly's just showing as well, which is that ERX icon. Okay, and the next question here is around, can one change between printing and faxed e-prescriptions without logging on and logging off? So for that one, you can obviously do your signature exempt prescribing, and you can print your medications or not print your medications, as Holly's shown in the demonstration. Faxing e-prescriptions, if you enable that capability, allows you to fax it without going through that process as well. So faxing is just another alternative way for you to be able to send those scripts through to a pharmacy. Okay, so that's all the questions we've got, Holly. We've covered pretty much all of them.
Fabulous, thank you guys. So remember, a recorded copy of this webinar will be made available sometime mid next week probably. If you do have any other questions, or if you asked any questions that we didn't address today, we'll get in touch with you. Otherwise, just reach out to our support team and we can answer any other questions you have. Thank you, everybody.